All right, let's go ahead and get started. So everyone, welcome to today's webinar on mobile health and messaging strategies for improving patient experience and loyalty. I am Christopher Vinson, and I'll be today's webinar admin. And our host today is Janice Dalen, and I am going to be throwing it over to her to tell you guys a little bit more about herself. So let's see, Janice?
Thanks, Chris. My name is Janice Dale, and I'm a project manager with Bridge. I have over 13 years of healthcare and analytics experience. I love healthcare data. I love what it can do for us to understand what's happening now and using that information to make predictions and interventions to improve outcomes. A few housekeeping items today. Just so that you know, everyone is currently on mute. If you do have a question, in the bottom left-hand corner, there should be an option to enter your questions in there. We have a section at the end where we can cover questions. And if for some reason we don't get to all of them, we can always have follow up with email after the presentation. So with that, let's just jump in. Our agenda today is a brief introduction of Bridge. Then we're going to really dig into healthcare data and how it moves with you. A summary of the data, how it follows you at your doctor's office, at the hospital, at home, and then some telehealth options as well. And then we'll do a wrap up on how Bridge can help in some of these areas. So first, thank you to Bridge for hosting this webinar today. Bridge has over 30 years of experience implementing solutions for mid-sized and large organizations, provide best-in-class consulting, support, education, staffing, but we really utilize a client partnership approach to make sure projects are designed for your success. And at the end, we'll come back to Bridge and how they can help with your mobile analytic initiatives. But let's jump into healthcare. When did mobility really take off in healthcare? How did it start? How has it grown? Mobile devices really started in 2002 with the BlackBerry, but since then they've become part of everyone's lives. Whether it's a smartphone or tablet, 64% of American adults own a smartphone, 42% own a tablet. Communication, research, maps, apps. I mean, technology has really revolutionized our daily lives. 87% of healthcare professionals use a mobile device, whether that's a phone or tablet in the workplace. And a lot of this is due to the development of electronic health records. They were required by the HITECH Act, and the availability of this information on mobile devices has been a necessity really in organizations in healthcare. Our doctor's office recently upgraded from their workstation on wheels to tablets, and now they have all the information they need at their fingertips in an easy-to-carry tool. In the presentation today, we're really going to discuss technology in healthcare from the patient's perspective, but also touch on the obvious importance to healthcare providers. So let's start off at your doctor's office. As a patient, you arrive and check in, and already information is being captured. The nurse is electronically notified that you're in the waiting room. Your electronic records are available immediately. They don't need to be pulled from an old filing system. And you don't need to fill out another medical history form because they have it all with them. Information on how long you wait can also be taken into account and determine what your probable satisfaction is going to be. Now a nurse comes to you and they take you back to get your measurements and enter them right immediately into their tablet, updating your record. There's no more paper to shuffle, no more transfer mistakes. What's even more exciting is there's some devices that transfer your vitals like temperature, pulse, blood pressure wirelessly. So there aren't even possibilities of typos. All of this is to save time because initially, honestly, the EHR applications were cumbersome and required really more upfront time to enter data. But they're improving every year and accessible to more devices and saving time in the end. So now you're waiting for your doctor. Your doctor no longer needs to flip through pages of your medical history before walking in the door. The EHR has your full history and highlights the topics the doctor needs to focus on, why you came today. Every patient's data is displayed the same way, so they don't have to read pages of notes and history, but can really get an understanding with a few key indicators. A lot of EHR applications also highlight abnormal vitals to draw the doctor's eye to have that conversation that's important for the patient. Questions are asked, answers are logged, all in one location. Prescriptions are written immediately and transferred to your pharmacy for pickup or mail order. There's no more prescriptions lost, no more fraudulent prescriptions by fraudsters that stole the RX pads. And referrals are also made immediately. No more wondering if the appropriate paperwork is faxed to the referral and insurance. It can all be done at one place at one time, and you know that's been taken care of. What's also great is follow-up appointments can be scheduled and put on your phone or electronic calendar. All this is mobile. All this is available to the patients, to the doctors, to the facilities. So the use of mobile technology in your physician's office, the ER, other facilities have saved time for you as a patient, which increases your satisfaction. But it also has saved time for the doctors and nurses, allowing them to review and enter information at the time of visit, and not hours later when maybe an important item has been was discussed but missed when being taken down in notes. And the last topic, when you're at your doctor's office, analytic review. So analytics are really being built every day to identify patients that should be screened early for diseases based on your medical history, based on your risk factors. The goal is to bring to light issues early with your primary caregiver, so preventative measures can be taken instead of responding to a severe condition when it surfaces, which sometimes it can be too late, and it's definitely more expensive. So from your doctor's office, let's say for some reason you need to go to the hospital, an ER, an urgent care facility. When you check in, when you walk through that door, some facilities have wait times posted. This information is based on the current patient load, patient volume, staff availability, and historical information. So you know when you walk in that door whether you have a 10-minute wait or you have a 60-minute wait. Administrators, nurses, doctors, they have utilization stoplight colors on their tablets. Different workflows, patient response procedures can be developed based on volume. So during slow times, the doctor might gather additional information they need when they speak with you. But when it's busy, an administrator can take that information and enter it in the system, saving the doctor time so he can really focus with you on the clinical information he needs. These analytics are working behind the scenes to improve knowledge and the processes to see patients effectively. Mobile information is available at their fingertips. Utilizing an EHR, much of your information is shared with the facility. They can review the prescriptions you've been prescribed, see the ones that you have not filled, and double check that against with what you say. Information is really power. Understanding a patient's prescriptive past can inhibit narcotic abuse and resale. I really like to think the best of everyone, especially when it comes to emergency situations. But the truth is that without an accessible prescription history, some patients abuse the system. They would receive narcotics at their primary care physician, sometimes multiple primary care physicians, and then more from ER facilities. And the excessive prescriptions really can lead to abuse and resale, which is not what we want to see in our healthcare industry. Often in an ER urgent care situation as well, tests are ordered, right, to provide a fuller picture to the doctor and specialist. But because electronic medical records are available, they can see you just had an MRI a month ago. Maybe you can access that MRI before ordering a new one. The hope is that by being better informed, healthcare costs can decrease. Less unnecessary tests, less unnecessary prescriptions for everyone can lower healthcare costs, which in turn should lower healthcare insurance premiums. Now, nurse rounds can also be prioritized based on the needs, based on the last time they visited a patient, based on the medications that need to be administered. Analytics can be used in a variety of ways in hospital settings, including improving efficiencies for nursing staff. So dashboard analytics available on their tablets, available on their phones, can signal high-needs patients and the next interactions that need to occur for each patient. Vitals can be monitored remotely, and nurses can be alerted of changes. And then lastly, one thing to mention at a hospital or facility, an important process is the transition of care from that facility. And perhaps it's to another facility where clinical staff can take care of your needs, but often it's a patient discharged. Personally, this has been a weak area in the facilities I've been to in the past, but improvements are really continually being made. Years ago, I had knee surgery at an outpatient facility, and I remember they discussed next steps and the pain procedures before being discharged, but I was fuzzy from anesthesia. And honestly, my husband was trying to listen while also taking care of our toddler. We had a paper reference, but even for two well-educated adults, the transition did not go as smoothly as it could have. And now I think of my parents, two people that are confused by anything outside of their normal schedule and can understand how transitions back home from a facility can be unsuccessful for a large percentage of the population. Confusion leads to readmissions, and this is especially true for people that don't have a support system when they come home. Healthcare organizations are now implementing a number of solutions to help with these transitions. Patient portals can have task lists and reminders. Care specialists can follow up via phone with patients after a patient's been released. Again, your patient record is following you, so they know the procedure that was performed. They know the recommended next actions, and they often have notes on concerns about you. Have I mentioned yet that knowledge is power? Because it's the power to have better health. Although the road to the electronic health record has been a bit bumpy and will continue to have a number of bumps and twists and turns in the path, the immediate improvements are improving processes, health outcomes, and patient satisfaction. So now you're at home, or maybe you didn't even see a doctor recently. How does your medical data follow you at home? Well, patient portals provide all your health information from latest lab results, prescriptions, billing information, to highlighting educational material for patient conditions. Patient portals provide targeted and easy to understand analytics, so the full spectrum of patients can understand what lab scores are below or above the optimal health ranges, and also make recommendations on how to pull those scores back in line. Pregnant women are provided helpful documents, webinars, advice, blogs. Patients that smoke are provided smoking cessation information. Healthy diets and information about the benefits of exercise can be available to everyone. If you're interested in improving your health, your patient portal should be your first stop. Patients can post questions to their doctors or nurse assistants from the comfort of their own home. You can make appointments online. The goal of these portals are to engage the patient population. If you can drive them to a portal, they're actively engaging in their own health care with the hopes that this will increase their health and decrease the cost. Now, this is especially important for our millennials and a large number of tech-savvy individuals that would rather answer a text message than a phone call. They would rather information was provided to them at their convenience, at their fingertips, than scheduling an in-person appointment. Patient portals and our next topic on wearable health applications are really areas where we can tap into that millennial population and improve their health, engage them. So when it comes to wearable health applications, another way to drive patients to portals are these EHR integrations with wearable health applications. The Fitbit, Apple's Health Kit. I mean, how many of you own a Fitbit or a similar personal health monitoring application? 2 years ago, they skyrocketed on the market. Almost everyone I knew was wearing one and notifying everyone that will listen about their sleeping patterns and the number of steps they've taken per day. Exciting times for me is when health is a primary topic of conversation over some tedious reality TV show. A number of EHR vendors integrate with these wearable devices, allowing patients to be more engaged in their health. As organizations work together to try to create care plans for overall wellness, this information can be tapped into to understand their current activities, their current sleep patterns, and guide the patient on the next steps. This is preventative healthcare at its best because it's engaged patients monitoring their health and looking to improve, not reactive, but proactive. And then I just want to touch on the continuum of care again because this is really important to me. I mean, once a patient has been sent home from the doctor's office, from an ER or a facility, they're given instructions. Some are simple, like taking a course of antibiotics. Others are much more complex. Recently, following up on a patient post-discharge has been integral in really driving down those readmissions and their associated costs. Care and quality services are available in the market that highlight the patients that have the highest risk based on their medical history, based on their statistical risk indicators. And these patients really need to be followed up with to determine their following discharge instructions. They've set up their next appointment. They plan on attending that next appointment. A few minutes of an administrator or nurse's time in these situations can really mean the world to a confused patient. Providing additional care they need and keeping them from returning to the ER is a goal everyone wants to meet. Now, I have another parent story. My dad had to have stents put in a few years ago. Now, let me first say my father is a very stubborn man, and he tells my mother very little about his health or what is said at the doctor's office. Of course, she was there with him that day, talked to the doctor, and they were sent home with written discharge instructions. My mother tried to follow the letter of the discharge instructions. My father said she was fussing, and the nurse just said he needed to do X, Y, or Z. There was a tension in the household and a refusal to call the doctor to clarify instructions. But a simple call from the nurse practitioner following up post-discharge was able to get my father back on track, because he won't listen to my mother and he won't read instructions, but he'll listen to his doctor or nurse when they're firm with him. So this continuum of care, following a patient past discharge and recovering in their own homes, is really important to the health of that patient, to decreasing readmissions, to having healthier patient populations. So the last fun topic is telehealth and telemedicine. What's the difference? A few years ago, I didn't know the difference, honestly, but I just want to clarify for everyone here. Telemedicine describes the remote clinical services like diagnosing and monitoring a patient. Telehealth is an umbrella term that can refer to those clinical services. So telehealth is an umbrella that underneath it, telemedicine exists. But it also has non-clinical services like different trainings or meetings or continual education. So telemedicine has been around for a long time in a limited scope. In the 60s, NASA actually spearheaded telemedicine for space flights. There was a program that provided telemedicine to both Native Americans on a reservation in Arizona, along with astronauts in orbit. I think it's incredible that we can have telemedicine doctors visits with people that are orbiting in space. In 2016, telemedicine has really grown by leaps and bounds, not only for long-distance health services, but for convenience. I mean, some benefits of having telemedicine: you're not waiting in a waiting room with other sick people. There's no driving, parking, etc. to get to your appointment. You're likely already in a relaxed environment. I know my husband's blood pressure goes up every time he's in traffic. So his blood pressure at the doctor's office is always high. But at home, he's more relaxed. His blood pressure really reflects that. So another great use of telemedicine, telehealth is this an emergency? So your baby starts screaming at 3:30 a.m., 4 months old, 104-degree temperature. Do you go to the ER? Do you wait it out? What do you do? I mean, as a new parent, this is a struggle that every parent goes through. Well, telehealth is available. There's nurses on the lines that have access to your EHR. So look, that information can continue to follow you through a telehealth environment. They have years of experience, great recommendations. So telehealth is not only good for new parents trying to find the fine line between emergency and illness, but it's beneficial to patients embarrassed to ask their doctor face-to-face about a possible medical issue. What's great about telehealth now is access to your EHR, right? They can review your electronic health record and understand your medical history, and if a high temperature is more serious because of your circumstances or not. Telehealth and the access to these folks are really improving by leaps and bounds every year. According to American Well's 2015 telehealth survey, 64% of patients said they would have a video telehealth doctor visit. Now, Kaiser has been doing video visits for a few years. 98% of patients with video visits were satisfied with their experience. The Mid-Atlantic region alone handles over 10,000 video visits a year. And that number continues to rise double-digit percentages each year, while in-person office visits remain flat. Kaiser allows for video visits without a copay. Doctors can handle 6 visits an hour compared to 1.6 office visits an hour. So 6 remote video visits an hour compared to 1.6 in-office visits. That's a significant difference. And still, they can schedule referral appointments, lab tests, etc., for their patient to follow up and get the care that they need. Now, Mercy Hospital, just outside of St. Louis, has started a telehealth pilot program. The hospital, and I'm putting quotes around this that you can't see, but the hospital is a 4-story hospital with 0 beds. It allows for them to care for patients 24 hours a day. It's a pilot program. It has 250 patients with complex chronic illnesses. And the goal is really to avoid high-cost healthcare expenses by providing care when and where a patient needs it, preventing $41 billion in hospital readmissions. The hospital supplies an iPad to the patient. They also supply other tools if necessary, like a blood pressure cuff or a pulse oximeter that can be connected to the iPad. They also have they also have navigators. So the patient typically works with the same navigator or person, and they build trust together with regular conversations. And one patient, in the limited time they've been open, was kept out of the ER twice because a diagnosis could be performed online quickly and conveniently. The pilot has so far seen a 33% decrease in ER visits and hospitalizations. Now, 33% decrease is huge, but when you think of complex chronic illness patients, 33% is life-changing. They no longer have to rush to the ER for every single question, every single concern. They can get the answers they need from remotely via their navigator. So it's obvious to see this type of healthcare will continue to grow, and it can satisfy patients' needs with increased convenience and lower cost. So I had a lot of information to get into the short presentation, but to wrap up today, there's kind of 4 key points I want to talk to you about. Electronic health records are integral in sharing data, understanding your patients. The road's been bumpy. It's going to get better with better interfaces, better technology, and better cooperation in sharing data. The other point, patient engagement. Whether it's an office visit, a patient portal, following up post-procedure, wearing a Fitbit, engagement is really key in this mobile world with more tech-savvy patients to improve patient health. Knowledge is power, right? You hear this in other industries as well, but putting that power and information into the hands of your patients is another step to empower them to have better health. Having all their information at your fingertips as a provider allows you to provide the best options to improve their health. And then lastly, telehealth can benefit patients with convenience and providers by allowing more services in a limited amount of time. Telehealth does not have to sacrifice your personal relationship with your patient. These relationships can be maintained and grown with video conferencing and messaging. So I want to thank you all for your time today. I'm going to hand the presentation over to James Archer, our Vice President of Healthcare, to tell you how Bridge can help with your mobile and analytic needs going forward. James?
Thank you, Janice. Tying a bow on Janice's presentation are these 3 elements here. I wanted to mention just a few additional considerations. From our research, there's currently no clinically relevant risk assessment framework for medical apps. So it's incumbent upon healthcare practitioners, patients, and app developers to find it challenging to quickly assess the risk posed by these mobile health applications in order to develop a comprehensive risk assessment framework, and basically to be able to distinguish the different kinds of risks. It's a big concern today with the widespread use of high-quality apps by healthcare practitioners and patients. To be welcomed, there has to remain a significant potential for harm in the way of security breaches of PHI and PHR. So the risk to patient safety and professional reputation are real, what we're finding, and steps should be taken to mitigate these risks. So identification of all the different kinds of risk and the key variables that influence risk are key stages in the development of these kinds of risk assessment models, which should also take into account app complexity and the probability of harm and security breaches, right? A lot of people like to think in terms of mnemonics. So 4 C's, where variation in mobile health has been reported occur in these 4 areas. So culture of information and technology adoption, capacity to manage and effective implementation, use, and maintenance of new mobile app technology, connectivity, which refers to the interoperability of the information and technology systems, which Janice mentioned, the EMR platforms that you have, and obviously cost or financial implications. Bridge may assist your healthcare organization by creating a mobile health readiness assessment that addresses these 4 C's, along with potentially other analytics data, financial, back office, EMR data, clinical data, and performance challenges you may currently have. Bridge would be more than happy to discuss these offerings with you in a follow-up call if you're interested. So with that in mind, that's all I have to say. On behalf of the entire Bridge Healthcare team, we really appreciate your listening in today. And I will now turn the presentation over to Chris for Q&A and wrap-up, as I see a few questions that have streamed our way. Thank you very much, everybody.
All right. Well, thank you very much, James. James is correct. There are a couple questions in the docket for Q&A. I'm just going to go ahead and start with the first one. So in what ways can mobile apps have a proven ROI?
Yeah, that's a good question. So mobile apps can, as Janice mentioned in her presentation, they can really help people manage their own health and wellness, promote healthy living, and gain access to useful information when and where they need it. So these kinds of tools are being adopted almost as quickly as they can be developed. According to our research, Janice mentioned 2015-16. By 2018, I read that 50% or more than 3.5 billion smartphone and tablet users will have downloaded mobile health applications. So that really includes healthcare professionals, consumers, and patients alike. Is the best way to answer that. As far as a specific ROI and a total cost of ownership, well, we haven't actually conducted one of those, but that's the data that we're finding right now.
Great. Thank you, James. So we have another one here. So that question, it begins, would the provider have to have a formal documented risk analysis for using mobile applications for communicating with patients?
The short answer is absolutely. So a periodic assessment of the risk and vulnerabilities to protected health information, PHI, PHR, is required of every covered entity. So that risk analysis must include in its scope all the PHI, the systems, the infrastructure, and the application upon which it's created. Data is collected, processed, stored, archived, and deleted, whatever it is. So that would include, as I mentioned, this particular PHI, the systems and the vendors and the staff members utilize all who are utilizing the system.
Great. Well, thank you, James. I think we have time for one more question. This one begins, so in my experience, the lack of transparency in BAAs makes the process complicated and the legal fees make it not seem worth it. What can be done?
Yeah, the BAA process is arduous at best in many organizations. I think the comment regarding a lot of people say boilerplated BAAs is appropriate. So most companies, organizations that I work with, they print out a BAA, write their name on a line, and that's all that's involved for them. Well, we think the BAA should actually spell out the particular uses and disclosures that healthcare organizations will engage in and what security safeguards are going to employ. I don't think legal firms would be particularly useful in this regard because this is less about legal liability and more about information security. So the BAA, Business Associates Agreement, should really represent the act of two entities that have a dialogue on how to make sure that PHI and PHR is secured.
Great. Well, thank you for that answer, James. I believe that is all we have time for today, and that concludes our mobile health webinar. If you have any additional questions, comments, or would like to learn more about Bridge and their services, please reach out to Janice Dalen at janice.dalen@bridge.net. And if you would like to keep up with any future Bridge webinars, content, or events, you can follow them on their LinkedIn page at linkedin.com/company/Bridge. As well, you can also learn more about them via their website at bridge.net. That concludes today's webinar. Thank you, everyone, for joining us, and I hope you have a wonderful rest of your day.